Welcome to the STARS Beneficiary Contact Data Entry Basics webinar. Today, you will learn to understand beneficiary contact definitions and data entry processes. We'll provide recommendations for when to enter beneficiary contact forms, or BCF, versus a beneficiary additional session, or BAS form, or how to indicate that a beneficiary contact is a MIPA qualifying or SMP qualifying. There will be a demonstration of how to complete these forms, and we will provide answers to frequently asked questions. Attendees will also leave this webinar knowing where to find more information about using STARS. This webinar is being recorded, and the recording will be available in the SHIP resource library by the end of the day tomorrow. Handouts are already in chat as well as in the library, and the resources link is currently in chat. Speakers today will be Sarah Fleming. She's the Training and TA Manager at the SHIP Technical Assistance Center, and Jenny Paulson, the Director. And for our agenda, we'll talk about definitions and guidance, MIPA, sent to SMP, Part D enrollment outcomes, demographic data collection, demonstrations, and STARS resources. We are also supposed to be having Spanish interpretation on the call today. Before I started speaking, I did not see our interpreter on there, but hopefully he will be joining us as soon as I pass things over to Jenny to get things started, or Sarah, I'm sorry, whoever's doing the next slide. I will try and find out what's going on with that. So if you need the English to Spanish translation, I'll work on trying to get that, and we'll get that link into chat for you. All right.
Yes, thank you. So I can make an announcement to the Spanish speakers. Hola y bienvenidos a las personas que primariamente hablan español. Estamos esperando el intérprete para tener subtítulos en español. Disculpe, espere un minuto y el enlace para ver los subtítulos estará en el chat. Sorry. All right, so welcome everyone. This is our second webinar in a series about STARS, and so this is the one about beneficiary contacts, which we know is the most commonly used form in STARS. So welcome to everyone who is here. We have this image here to show who the STARS users are from the different programs that use STARS. So you might be from a SHIP or a MIPA program, because those programs report into STARS. You could also be co-trained SHIP and SMP team member, entering data into STARS and sending some of that data to SIRS. You could also be a SHIP with a duals demonstration grant, which you would know if you were that. There's a few states in the country that have that. Or you may be from a program that enters data into other systems and send that into STARS. And this is known as an API transfer from a proprietary system. So this is all the different ways the data gets into STARS. We can address any questions that you have about this later in the webinar. So next, we have a series of slides for our acronym checks, because no one likes acronyms they don't understand. This is an explanation of some of the different acronyms that are going to be used in today's webinar. So as we said in the last slide, so SHIP, SMP, and MIPA are different programs and grants that are federally funded, and they are managed by the Administration for Community Living. API is a term that we mentioned. It's not a term that you necessarily need to remember, but it is important to know the concept. So some state and territory SHIP programs have their counselors entering their data directly into STARS. And then some of them have them entering data into a different system that might be called PeerPlace or WellSky or another system. And then that data is transferred into STARS using what is called an API, application programming interface. But what you need to know is that some SHIP programs do not enter the data directly into STARS, but it does get sent into STARS. Some more acronyms for you. We mentioned ACL. ACL is the Administration for Community Living, which is a federal agency under the U.S. Department of Health and Human Services, and that funds the SHIP MIPA and SMP programs. And specifically, OHIC is the Office of Healthcare Information and Counseling. And this is the specific office that manages and oversees these grants. And we have some representatives from OHIC under ACL today. Then two acronyms that we're going to be using a lot are BCF, stands for Beneficiary Contact Form. This is the main form that's used for entering beneficiary contacts to document counseling sessions in STARS. We also have the Beneficiary Additional Session Form, or BAS, that we'll be explaining in depth in this webinar. So this is a form, you can think of it as a sub-form that is attached to the BCF, Beneficiary Contact Form, and may be used for follow-up counseling sessions to the initial beneficiary contact form. So now we have a series of polling questions to get to know our audience. It's always helpful to know who's here. So this first question is, what is your user role in STARS? So if you just enter data in STARS, you may be like for beneficiary contacts, you may be a submitter or team member. If you have a manager role or a state staff or director, assistant director role, you'd likely know. So enter that in, and then Sue will end the poll and we'll look at the results.
We have quite a few people still answering, so I'm going to just give them another moment. Please do make sure that you hit submit so that we can capture this. And of course, if you don't know, that is an option as well. All right, we've hit 80% and it's slowed down, so here we go.
All right, so it looks like kind of as we expected, the majority of people here today are STARS submitters and team members. That's probably the likeliest, the biggest demographic that's entering those beneficiary contact and beneficiary additional session forms to document counseling sessions. To anyone else who's here from other user roles, welcome. You may be entering your own contact forms because you've done your own counseling, or you may just want to know how other staff or volunteers enter those forms so you know how to analyze the data. So welcome to everyone. And we have another polling question here. So this is, how long have you used STARS, just to see how new our users are today. And so I've never used it. I've used it for 6 months or less, 1 year or less, or over a year. All right, it looks like it's slowing down, Sue.
I'm sharing results now.
Okay. So overwhelmingly, most people have used it for over a year. We know that a lot of our SHIP counselors have been here for a very long time. So this validates that. So thank you for coming. Some of this content may be a repeat of content that we've presented before, particularly some of the content from a beneficiary contacts webinar from 2 years ago, although there is new content because STARS has changed. And then we'll also be repeating some information about new fields in STARS that were talked about on Tuesday, but we'll have another chance to talk about them. So thank you. All right. So, and Sue, is there any update about the Spanish captioning?
No, I sent them an email with an exclamation point and I have not heard back. I'll cut in as soon as I see something.
Ok, estamos esperando al intérprete para tener los subtítulos en español. Okay, so thank you. So the first thing that we're going to be talking about is definitions and guidance. And so we're going to go into depth about some information related to when to enter a beneficiary contact form and an additional session form, which we know is something that people have a lot of questions about. So first we'll talk about what is the definition of a beneficiary contact. So this here comes directly from Chapter 4 of the STARS manual, which if you haven't looked at it is sort of the source of everything related to beneficiary contacts. It's got all the information there. And so here it's all context for the purpose of relaying Medicare and SHIP-related information between, it has to be a properly trained and state certified SHIP team member and a Medicare beneficiary or a representative working on their behalf. So in essence, this is a counseling session. To be considered properly screened and trained, team members have to complete the screening and training required by their SHIP program and be certified by their SHIP program. And so that can vary from state to state or territory. And so you should check with the people in your state or territory program to know what the requirement is there. And then they have to be considered to, be properly trained, screened, have to be registered with the SHIP program, and be actively providing counseling, information, or assistance related to Medicare. There are some things that beneficiary contacts do not include that we sometimes get questions about. So you should not enter a beneficiary contact for these instances. So for example, if you were trying to reach a beneficiary but were not successful, so leaving messages on an answering machine, this isn't a database that's keeping track of every contact you have with a client or attempted contact. This is an actual counseling session that occurred. And then individuals that are reached at public events, such as presentations or health fairs, there's a separate form for that. That's a group outreach form. And any calls and contacts in which the only purpose is to schedule an appointment. Again, this isn't every contact that you're having with the beneficiary. This is just any contact in which counseling information was shared. So a counseling session. And also, if this only purpose is to refer to another agency or program, that should not be entered. And any unsolicited or mass mailings to SHIP contacts do not count as a beneficiary contact. We get some questions. We'll go over in the demonstration how to enter a beneficiary contact. So data is entered in a form in the tracking inbox. And so you hover over tracking inbox and go to beneficiary contact. And that is how you access the main beneficiary contact form, or BCF, in STARS. And then after going over our slides, I will do a demonstration of how to enter a beneficiary contact. Now I will get a little bit more into the BAS, or beneficiary additional sessions, because I know this is something that people tend to have a lot of questions about. So there are two different forms that beneficiary contacts can be entered into, and people have some confusion sometimes about when each can be used. So the first place is the beneficiary contact form. I will start off by saying that if you enter every contact into a beneficiary contact form, that is correct. You can keep doing that. However, I'll tell you about the beneficiary additional session form so you can understand the instances in which that can be used. So the second form is the beneficiary additional session form. And to understand the relationship between the two, we use this term that's, I think, often used in database development called parent and child objects. So a parent form is a main form that you're working with, and a child object or a child object form is tied to and located and accessed under that form. So we'll show you what this looks like in the demonstration. And many of you who've been using STARS for a while already know that, through the tracking inbox, you access a new beneficiary contact form. And once that beneficiary contact form is saved correctly, you can then open a new beneficiary additional session form through that beneficiary contact form. So that may be a little confusing until we demonstrate it, but we do have a little image in the next slide. So you can see that when the beneficiary contact form is saved, there's a tab that shows a beneficiary contact and then a SHIP beneficiary additional session form. And so the purpose of the beneficiary additional session form is that it is there and can be used to illustrate complexity of a single issue. So if a beneficiary has multiple sessions that are all about the same issue, this is when a beneficiary additional session would be used. It should not be used annually for open enrollment sessions. So think of each year's open enrollment as a new issue. And you really think of it as a follow-up session. If you are having multiple follow-up sessions that are about the same topic as the first beneficiary contact form, those are the instances when you can use an additional session form. Again, you don't have to use an additional session form. It is also fine to open a new beneficiary contact form, but that is something you can do. And then people have questions about whether a beneficiary additional session form counts the same way. It does count the same way in reports as a standalone beneficiary contact form. All right. Oh, sorry. So there are some limitations to these. Some states, because they are complex and people don't always know when to use them, some states or territory programs may choose to tell their counselors that they only want them to enter beneficiary contact forms for every contact. So if that's the case, that's what you should do. But just make sure to check with your state programs. Also, the additional session form does not contain the send to SMP functionality, which we'll talk about later in this webinar. So data cannot be sent from STARS to SIRS within an additional session form. So if you want to send data to SIRS, you should enter a new beneficiary contact form. In addition, so the reason that the beneficiary additional session form exists is really just to reduce data entry work for the counselor. And so what it has when we demonstrate it, it has reduced demographic information. And so you're reusing the demographic information from the original beneficiary contact form essentially. But over time, there might be changes to the demographics. For example, age is the main thing that would change over time. And so if you were using the same beneficiary contact form and continually adding beneficiary additional session forms year after year, which is not what you should be doing, you would then have inaccurate, out-of-date demographic information. All right. So now we have our first section of questions. And then we actually have some more information about scenarios for beneficiary contact and additional sessions after this. So how are the questions going?
Well, I think they're going well. There have been a number of questions, most of them that we've been able to take care of. A common one, however, that I haven't yet answered is, why use a BAF? What's a BAS? What's the advantage of using a BAS? That's a common one.
Yeah, thanks. So the advantage of using a BAS is if your state allows it, and if you understand the situations in which it's appropriate, it can save you time with data entry, because again, it doesn't include that demographic information that takes up a lot of the space on a beneficiary contact form. So it's just a lot shorter. And so that's, I think, why it was originally created, is it's just some counselors wanted to be able to save time in certain instances where they didn't need to re-enter demographic information.
Another question that we haven't gotten to, it's kind of a lengthy one. If you fill in the topics discussed on the BCF, do the same ones need to be selected on the BAS?
Not necessarily, but it should be clear that it's a relevant follow-up contact. So if someone called like 3 or 4 months ago about, trying to think of a question, like they had a question about, I don't know. I'm trying to think of examples. If you have 2 counseling sessions that are 3 or 4 months apart, and it's very clear that the content is not related to each other at all, then that should be a new beneficiary contact form. So no, you don't have to select the exact same topics, but it should be clear that this is like a follow-up conversation related to the first contact. And we will, and Ginny's going to go over in the next section, some examples of, like, some pretty concrete examples of when you would use a beneficiary contact form versus when you may be able to use an additional session form. And I say may because, as I said before, it is always correct to just use a new beneficiary contact form if you are in doubt.
Some of the other ones, does a BAS and a BCF both count as a contact equally?
Yep. They're the same. They
Yeah.
count equally.
There's lots of questions coming in, but we're answering them pretty much as they come
Okay.
in. So
Yeah, thank you.
Well, should we move on, and then we have
Sure.
several Q&As built into this webinar, so we can make sure everyone's question gets answered before we're done here today. And now I'm going to present on beneficiaries with multiple contacts, and we have some scenarios for you. So one scenario is, what if there are multiple contacts on the same day? Perhaps during the busy open enrollment period, especially in SHIP programs where there might be a call center. Maybe somebody calls back and says, oh, you know, I got to thinking, I have another question now about what you told me, or, you know, something along those lines. So it depends on who is having that contact with that same person. So if it's the same day and it's the same person having that contact with that client, you just update the form. Let's say you already put the form in STARS, not on paper. So you would update your STARS data entry with the new information from that second contact. And you would just edit the time spent field to incorporate all of the time in that day that you, the counselor, spent helping that client. And you would add new topics discussed. Just use one form, even though it was in 2 phone calls or 2, you know, in-person contacts, however that went. If it is the same day, but a different team member helps that client when they called back or came back to the office, then the different team member should have a beneficiary contact form in STARS about their contact with that same client. So it needs to be separate because it was a different team member. It can be a new beneficiary contact form, but if that different team member is able to see the beneficiary contact that's already in STARS from their colleague, and if they are able to add a beneficiary additional session to it, they can also do that and put their name on the beneficiary additional session as the session conducted by user, even though the beneficiary contact form would have had their colleague's name as the session conducted by user. Now, based on your user role, you may not be able to do that, so you may have to enter a new BCF. And some of you
Jenny,
here, yes.
So sorry to interrupt, but we do have an interpreter finally on. So Amy, could you rechat the Spanish link? And Sarah, would you mind letting them know that we do have someone on now?
Hola, para las personas que primariamente hablan español, los subtítulos en español están listos. Para ver los subtítulos, haga clic en el enlace en el chat y abrirá una ventana nueva en su navegador. Disculpe la demora.
Thank you, Sarah. So what if you have multiple contacts with the same client, beneficiary, or caregiver on someone's behalf on different days? So if it is a different day, but the same counselor, same team member, if the contact is about an entirely new issue, you would enter a new BCF. You know, maybe the different day is 6 months later. You know, maybe the different day is the next year. If it's an entirely new issue, you would enter a new BCF. If it is a follow-up about the same issue, Maybe you ask them to gather some paperwork and call you back or come back to fully resolve their situation. Then you can enter a beneficiary additional session to the previous beneficiary contact about that issue. Now, we have heard that some programs just always use new beneficiary contact forms. That's fine. That's not wrong. So as Sarah tried to emphasize, really the BAS forms are for follow-up scenarios to the same issue. And again, she commented that the advantage is there are fewer fields to complete. These forms work together when it comes to the reports. So if a report needs to know the demographics of a client, the report's going to pull the demographic information from that attached beneficiary contact form. So you don't need to worry if there's information you find important missing on the BAS, because they are linked and the system is built to look at the corresponding beneficiary contact form when beneficiary additional session forms are used. So if you have a different day and a different team member, like before, that different team member needs to have a form entered on their behalf or by them about their contact with that person. And it can be a new BCF, or like before, if it is the same issue, but a different team member, they can enter a BAS if they have those permissions in the system. Let's say there are two beneficiaries counseled in one session. Let's say, for example, members of a couple made an appointment and they want to have their appointment together. They want to both hear what the team member is saying about Medicare to them. You will need to enter a beneficiary contact form for each person. They each need their own, they each need to be accounted for, they're each going to have different demographic information, and hopefully it's intuitive that makes a lot of sense. What you do though is it won't be the exact same time spent on each beneficiary contact form. It is the amount of time you spent. So in that session, in our rather simplistic example, for the sake of describing easy math, if you spent an hour in that session and you happen to spend, half of it with one of them and half of it on the situation that pertained to the other, then you would enter 30 minutes on one person's beneficiary contact form and 30 minutes on the other person's beneficiary contact form. However, you would divide it realistically. If one person's plan comparison, was very short and the other person took longer, you just enter the amount of time that pertains to each person. So now we have some scenarios and we're going to have you use our poll to answer what you think is correct. So in this scenario, James, a Medicare beneficiary, calls and talks to Gretchen, a SHIP counselor, about switching to a new Part D plan during open enrollment. He wants a few days to make a decision and get your help. So he calls back 3 days later and Gretchen helps him enroll into the Part D plan he has selected. In Gretchen's state, they allow counselors to enter beneficiary additional sessions forms. Can Gretchen enter a beneficiary additional session form in this instance? So the poll has opened and I see answers are coming in. Thank you everyone for participating. A lot of people are answering, so the numbers are raising quickly. We'll leave it open. We'll continue leaving it open so you have a chance to think. All right, I think we can look at the answers now. Sue is sharing the results. Thank you, Sue. So we have 26% saying you have to enter a beneficiary contact form. and 74% are saying it's okay to enter a beneficiary additional session form. So now we'll go to the correct answer. Whoops, I'm sorry. So the correct answer in this case is yes, it was about the same issue. It was the same counselor. It is fine to enter a beneficiary additional session form in a state where they're saying that's fine with them too, that you use the beneficiary additional sessions forms. The good news is either is correct. So now we're going to move on to our next question, which is about Wendell, a Medicare beneficiary who speaks with Tasha, a SHIP counselor, about eligibility for Medigap plans, and he calls in July. Then in November, he calls and speaks with Laura, another counselor, to learn about Part D and Medicare Advantage plans available in his area. So we're going to open another poll. Laura's state allows counselors to enter beneficiary additional sessions forms. Can Laura enter a beneficiary additional session form in this instance? And Sue is has opened the poll. And we have the answers rolling in. We have, by the way, almost 600 people in today's webinar. So the answers are starting to slow down. We have about 400 people have responded. So why don't we go ahead and look at the results. So in this case, we have 86% saying you must enter a new beneficiary contact form, and 14% saying if your state allows it, it would be okay to enter a beneficiary additional session form. In this case, the correct answer is actually no. No, that you should not enter a beneficiary additional session form in this instance, because this is about plan comparison during open enrollment, and the Medigap counseling was unrelated, that they're different enough issues that it should be a new beneficiary contact form, and some time has passed. As Sarah mentioned, demographics can change over time. So in this case, you would just always enter a new beneficiary contact form. You've had so many great questions about these forms, and we have a resource that was published a few months ago. Shona on our team created this, and just want you to know that it's available in the library, and we have the slide just clarifying, you know, BCF versus BAS, and at-a-glance reference to this issue. So we hope that this slide helps you. And I see that there have been a lot of answered questions. There's some open questions. So I think at this point, I'm going to change the slide, and we will answer some of those questions. So Dennis, can you share some questions with me to answer aloud?
Yes, one of the very common questions has been this question about how long between a BCF and the next BCF does it have to be? You know, there's a question about length of time. That's a common question.
Okay, the length of time really is not the issue, or is not the decision-making factor. It's what are they calling about? Is it a new Medicare issue, a new Medicare need that they're calling about? You know, sometimes somebody's new to Medicare, they call and get their new to Medicare counseling from you, maybe, you know, a Medigap plan comparison. And then because of when their birthday is, open enrollment comes around pretty quickly, and they may call back and ask for some, you know, Part D plan comparisons. Maybe there were only a few months in there, but those are different issues. Those are different Medicare topics. And so it's really not about the time that has elapsed from one counseling session to another. It's about what is their need. Are they calling you in follow-up to their previous session? And, you know, if it's not very much time that has elapsed, you will be making a judgment call on if it's a different issue or the same issue. You're the experts out there on Medicare and on Medicare counseling. But the rule of thumb isn't time. The rule of thumb is the content of the session. And then while Dennis is looking for another question, I see somebody is wondering, well, how do we know if our state allows beneficiary additional sessions forms or not? If they haven't said don't use them, then chances are you're allowed to use them. We, nationally, there's no prohibition on beneficiary additional sessions forms. You would just follow the guidance we're providing in this training, the guidance that's provided in the manual and in our other training materials. But if at the local, regional, or state level, they just really don't want you doing that, then nobody's going to interfere with their decision, because from a data accuracy standpoint, it's fine to just enter a new beneficiary contact form. It's not going to negatively impact the accuracy in the system.
So another question here is, if I'm talking with a caregiver about a beneficiary, who do I actually put down as the person in the form?
There are fields that ask for that information, and it's not even required to enter beneficiary names. But when you get to the demographic information, they're asking about the beneficiary, not the caregiver's demographics, is my understanding.
And there were two other questions, but I think those are probably more related to maybe team member management to some degree, but who can I see? If I'm entering notes for somebody else, who can I see and who can't I see?
The user roles determine what you
Yeah.
can and cannot see in STARS, and we have a user roles simplified guide and video. There's also a 2-page at-a-glance reference that's a little more complicated to look at. It's meant more for people who are creating team members in STARS, but we have also Chapter 3 in the STARS manual. But if you're a STARS submitter or team member user, I might recommend that you use the simplified guide and video that we created to help understand all of that.
And then we've had a couple of questions about how do I find information? And that's more about searches than.
Yep.
Yep. And that'll be coming up later. We'll have a training on searches and reports.
Right. And the search menu allows you to use the standard search if you're a STARS submitter. If you have a higher user role, you also have access to an advanced search. But for finding beneficiary contacts by other people, the standard search will work very well. And there is a field for, all of the information in the beneficiary contact forms, other than topics discussed, can be found in the standard search. So you would just select a corresponding field and do the search, and then it'll show that to you. The tracking inbox is also a way to find beneficiary contacts, but that's more related to your data entry and your sessions. You're not going to see sessions entered by another team member where their name is in the session conducted by field, unless you use the standard search. And I see, is there a time limit for working on beneficiary contact forms before you submit? They will give you a 5-minute warning after 25 minutes. And after 30 minutes of inactivity on the screen, it'll time you out. So as long as you're active on the screen, it lets you stay active on the screen, typing, entering, you know, it's not going to start the clock running, but once you pause, the clock starts running. So I'm just looking at, speaking of time, I am going to actually turn things over to Sarah, and then I can help in the Q&A as needed. So those of you hopefully on today's webinar have seen the Q&A module, and you can see the answered questions. And we also can pull a transcript of the Q&A and make a resource to go in the library with this webinar recording. So we have other Q&A sessions, and I don't want to cut into Sarah's demonstration. So I'm going to turn things over to her right now.
Thank you, Jenny. So we have some slides here first about some different topics, including MIPA and SMP, and then some brief information about the Part D enrollment outcomes. And then I believe there's a little bit on demographic data collection, and then it'll be my demonstration. So, all right, so briefly, you know from the beginning of this webinar, and also I'm sure any of your time entering data into STARS, that MIPA data can be entered into STARS. There is a button that is toward the top of the beneficiary contact form that says MIPA, and you can select yes or no. So in a nutshell, MIPA trained team members are the ones who can enter MIPA qualifying beneficiary contacts into STARS. And so there are certain requirements that need to be met for the contact to save correctly. If not, there will be an error. So these are the requirements. So yes must be selected under the MIPA field, as you'd imagine. Also, there need to be MIPA qualifying topics selected. Chapter 4 of the STARS manual has a detailed list of the different MIPA qualifying topics, but generally speaking, they are related to MIPA related issues such as Medicaid, extra help, other services for people who are low income. But again, you can look in chapter 4 for the list of those topics. In addition, the person who is in the session conducted by field, who is often the person entering the contact, must have MIPA selected in the program field in their team member form. And so you are able to go into STARS, and if you click team member form in the tracking inbox, you can look at your own team member form and see the different programs that are selected in the program field. The options are MIPA, SMP, and SHIP. And MIPA does need to be selected, otherwise you won't be able to enter that MIPA data. There will be an error. But any changes have to be made by manager, assistant director, or director, or a state staff user so that they can edit that team member form for you. Then we have send to SMP, similar but a little different. Send to SMP is a functionality where data that is relevant to both SHIP and MIPA can have a duplicate copy sent to SIRS, which is the SMP data system. So this has to be done by co-trained SHIP and SMP team members. The requirements to send this data are a little similar, but again, it's not just saving the data in STARS, it's sending it over to SIRS as well. So yes must be selected under the send to SMP field. And then there have to be SMP qualifying topics selected. Chapter 4 of the STARS manual also has a list of these topics, but broadly they are topics related to the SMP program. So related to fraud, errors, and abuse in general, and some other relevant topics. And then the person who is in the session conducted by field, often but not always the person entering data, has to have SMP selected in their program field. And again, this has to be any edits have to be made by a higher level STARS user. Some additional considerations for send to SMP. Remember that this is actively sending data to be separately saved in SIRS. So we don't want all contacts by someone who is SHIP and SMP co-trained to be sent over. You should really only send the data over if the SMP qualifying topic was discussed substantively. Not every single contact should be sent to SIRS. So for example, if you do a SHIP, mostly SHIP related counseling session, and at the end you just give them a flyer to related SMP, that may not be considered substantive enough to be sent. The chapter 4 of the STARS manual has some more information in the definitions about what's considered substantive, but don't automatically send everything over. So beneficiary contact forms can be sent to SIRS. However, the additional session form does not have a send to SMP field. In addition, any edits that are made in STARS to something that has already been sent to SIRS, the edits won't be made in SIRS as well. So those edits do have to be made separately in both systems. All right. So now, before we get to questions, I'm going to talk briefly about Part D enrollment outcomes, which are something that people also have a lot of questions about. And because this is a topic that we can talk for 1 or 2 hours about, it's very large. I'm just going to give an overview and then point you to different resources, because there are a lot of resources that we have already created on this topic. So the Part D enrollment outcomes tracking is a project by ACL using STARS to collect data related to cost changes as a result of SHIPs helping beneficiaries enroll into Part D prescription drug plans or Medicare Advantage plans with prescription drug coverage through the plan finder in most cases. So when you are entering a beneficiary contact form, the first 2 special use fields, which you will see, they're toward the end of the form, you'll see when I do the demonstration, are where you would enter data from the plan finder. And that is data on what the beneficiary would have been paying prescription cost-wise before the change was made and what they are paying after the change was made. So those are the original and new PDP, MAPD cost fields. And if that sounds very confusing and complicated, it's because it is extremely complicated. So we have a lot of different resources that show how to do this, including we have a new interactive online course that's extremely in-depth and provides information about how it kind of helps you every step of the way with entering this. And you can find that in the STARS resources kit when you log into our website. And then there is a Part D enrollment outcomes or PDEO section. There is also a special chapter, chapter 7A of the STARS manual, which also demonstrates this content in more of a narrative format. If you're someone who learns by reading as opposed to kind of doing, you can read it that way, and it explains exactly how to do this. And then we also have video demonstrations if it's helpful for you to watch someone else do it. Those video demonstrations are also in the interactive online course. So just pointing you to the resources today. If you have questions about accessing them, we're happy to help you access those. So some questions about this section?
Actually, I only see one question.
Okay.
And I can read it. If the person says he or she will change to the new Part D plan, but you don't know if they do we still enter the new cost, assuming they make the change?
So this actually has to be an instance in which you helped them change, like you were hands-on there helping them change. And so you know that the change was made. So in that instance, it would be a no.
So another question is, what happens when the person is new to Medicare in terms of Part D enrollment? Oops, my question moved on me. Outcome entry. We certainly are productively saving money for the beneficiary, but there is no previous Part D cost to compare it to. That's a common question.
Yeah, so that's a very common example. You can still enter the Part D enrollment outcomes data when the person is new to Medicare. There's a different process. Instead of comparing 2 different Part D plans for the original cost, so before the enrollment, you're actually using retail costs. And that chapter 7A, the interactive course, have separate sections that lay out exactly how to do it in that instance. And then there's also a separate video in the micro training video demonstrations that shows how to do that. But you still get the data from the plan finder and you still have to help them make the change.
And do we have to have the paperwork entered to enter the previous and new cost?
Yes, you do need the paperwork. If by paperwork you mean the it's PDF pages that you save from the plan finder showing the costs, and you do need to upload those into the beneficiary contact form. There is an document upload button at the bottom of the form.
And I think that was it for those questions.
Great. Well, Ginny is going to do a few more slides and then we'll
Oh.
have the demonstration.
Thank you, Sarah. So we're going to talk about demographic data collection, starting with the military question. In June 2023, the question, have you or a family member ever served in the military, was added to the beneficiary contact form. And we were asked, how do you define a family member of someone who has ever served in the military? And the answers were provided in a standalone FAQs document many months ago, but they've now been incorporated into the STARS manual also, and we wanted to reinforce the answers in the webinar today. So it is on your screen. They must currently be or must have been in the past been in the immediate household of someone who has ever served in the military. Furthermore, they must be related by blood, marriage, domestic partnership, or adoption to someone who is or was a member of the military. And this includes instances when the military service member is deceased, so they can be the descendants. Also, for that question, people were wondering, how do you define having ever served in the military? And the answer is, it is defined broadly and can include anyone who has served in the military, no matter their discharge status, when they perform their military service, or how old they are. So we're going to move on to demographic questions about sexual orientation and gender identity. The acronym for all of that together is SOGI, pronounced SOGI. And in the March 2024 STARS enhancement, questions were added or revised on the beneficiary contact form about sexual orientation and gender identity. This has been talked about in several webinars, especially in February 2024, in a webinar that was recorded and available to you in our website called Building Skills and Confidence in Demographic Data Collection. On the STARS form, there are 2 new questions, and then the answer options change for the gender question. These are the 3 SOGI questions. So new is, which of the following best represents how you think of yourself? And then, what is your current gender? The answer options have changed. And you see them on your screen here, and they're in STARS. These are little screenshots from within the STARS form. And then the third question is, do you consider yourself to be transgender? Now, people have commented that there seems to be some duplication here, and Maggie Flowers is going to talk about a decision by ACL to make some edits.
Yes, thank you, Ginny. And thank you all for your continued efforts to improve the demographic data collection. We really appreciate it. We are correcting the first gender identity question shown here on the screen in the white box, and anticipate the change being live in STARS and SIRS in May or June 2024. The corrections are shown in the green box, and those include changing female to woman, male to man, removing transgender, and adding non-binary. This revision will remove the duplication of transgender as a response option. While we await this update in the system, if a person responds transgender to the first gender identity question, Do not ask the second gender identity question because it may be confusing for folks. Next slide.
Okay, thank you, Maggie. So this is reinforcing what Maggie just said. We thought you might like to see it on a slide to make it clear since it was in her talking points on the previous slide for those of you who are downloading the slides. So hopefully this is abundantly clear. And to support you in this effort, there is a script and FAQs document about demographic questions, the military and the SOGI questions. It's also in the appendix of Chapter 4 of the STARS manual. And we provide a lot of avenues to our resources, and there are slides coming up after Sarah's demonstration about all of the resources and how to get to them, as well as in the chat. I know that Amy and Shona have been adding resources to the chat. And so with that, we're going to pause for questions again. And again, they
Well,
should go in the Q&A module.
Yep.
Sue asked me to reinforce that, and I forgot earlier. So I see we have a lot of chats, but those could be resources. So the questions should go in the Q&A module. And another reason is they make for a nice download so that we can create a resource for you to add to the resource library along with the recording from today. And now, Dennis, go ahead.
well, we've had a couple of questions, and maybe Maggie, someone should, Maggie or Jenny, why collect the military information? What's it being used for? There were a couple of those.
Great question. So the military question, as well as all of the other demographic data, helps us understand who we are serving. Veterans are a key demographic group that we want to make sure our services are reaching. And so this will help us understand who we're serving and where we need to improve.
Thanks. Another common question is, does my stepson who I raised count? Does my grandfather count? There are questions about specific relatives.
I'm going backward to get to that. Here it is. Oh, wait, one more. The answer, if they're related by marriage, that's a family member, stepchildren included, adoption. Looks like a yes there. And I can move forward. Again, I don't know how to skip ahead, so bear with my forwarding.
I think those are the why the SOGI questions. I think that's been answered. I mean, it's being answered for the same reason oftentimes that the military question is being answered. But I think based on the section that you've just done, Jenny, those were the primary questions.
Okay, great. Sarah has a demonstration, then we have several resources slides. So we'll continue answering questions in the Q&A module, and I'm going to turn it over to Sarah for her demonstration.
All right, thank you. So if you have been thinking this is all very nice to see it in the slides, but I'd like to see what it looks like in STARS, I'm happy to show you. So just one moment, let me share my screen. All right, you able to see my screen?
Yes.
Okay. So I will first say that I am not actually in STARS. I'm in a site that looks like STARS and acts like STARS, but it is actually our test site that we generally use for demonstrations. And it's where any updates to STARS are first rolled out and tested by national users before they are rolled out to STARS in general. So yeah, I'll just get started here. So most things look the same. So to access the beneficiary contact form, we're going to go to the tracking inbox, go to beneficiary contact and click new beneficiary contact. You can also access it by clicking on the tracking inbox clicking under beneficiary contact and clicking new. So that's your choice how you want to do that. It comes to the same form. So as I mentioned earlier, this is the parent object form, while the additional session form, which I will show you later, is the child object form. So as part of this new enhancement, a few things have been moved around. We're starting with the date of contact now in the form. And so it's going to default to today's date, and make sure you change this if you're entering past data. So ideally, you should be entering your contacts by the end of the month by the month after the month in which they occur. So the end of the month after the month where they occur. So if this is March, you want it to be entering it by the end of April. Also, there's been a change so that it can you cannot enter anything more than 15 months into the past or any time in the future, because sometimes people are making some accidental errors with their data entry. So we'll say that I'm actually entering February data now because it's the end of March. And so we'll say that this contact happened on February 22nd. And you can change it with these little arrows here. Okay, so now we have these various tracking fields here. We have the date of initial creation, who the session was entered by, date it was last updated, and who it was last updated by. And so these are not things you can fill out. They are automatically filled out when you save the form, and they're here to make it easier to search and find that data. And then they've been moved to the beginning of this form in this most recent enhancement. So the question is this contact MIPA related? And I'm going to click yes. I'm going to do a MIPA contact so that I can show you what that looks like. Send to SMP, same as I said, if you want it to be sent over to SMP, you would click yes. For both of these, you do need to have that field selected so that program field selected in your team member form, and then you also need to have qualifying topics discussed. The SIRS and SHIP reference numbers are things that you again can't enter into, and those will be auto-filled after you save. So session conducted by is the next field. It's a very important field. So this defaults to the logged in user, but sometimes that person is not entering their own data, and so you can change it. You would change it using the search button. But I'll just leave it, or let me see. Okay, you can search another user here, but I'm just going to leave it as the user who's logged in, who's a team member here. And so the partner organization is attached to that user. They have a specific partner organization that is in their team member form. And so that is automatically filled out based on the session conducted by a user. And I will say that in the past, I think over a year ago, this was a drop-down field, and now it's a search field. So that's a little easier because sometimes people who had access to a lot of different users were having trouble scrolling through the drop-down field. So now we've got the zip code of the session location. I'm going to enter that in, and the state and the county will default be added there. Sometimes there's a few different counties in each zip code, and so you can drop down and select that. And this is important. The county field is important to get right because it impacts reports, specifically impacts reports that are pulling information on how many rural beneficiaries were reached. That is determined by the county. Actually, sorry, that'll be during the county of beneficiary residence, but it is important to make sure counties are correct so that the rural information is correct. So now we'll get into non-required fields. Although these are not required, as in they don't have a red star. ACL would like you to collect beneficiary name and phone number whenever possible so that they can have a satisfaction survey for random beneficiaries who's received SHIP support throughout the country, which helps determine how the program is doing. So I'm going to enter Jane Doe, their number here, obviously a fake number. And then the beneficiary email information, if that's something that you're able to get from them and they're comfortable sharing. And then we had a question about if you're talking to a representative or their caregiver instead. So again, this is the beneficiary information, but you can enter their caregiver information here under representative information. So you can enter that there. So now we'll enter information about where the beneficiary lives, which may, as you know, be different from where the session was conducted. So and this, oh, I don't know if that was a wrong. Okay, yeah, I'll just go with this same zip code, although it can be different. It does default the state and the county. So this is something new in this most recent enhancement that Ginny went over on Tuesday. So there is a new check for duplicate records button. So this search is for potential duplicate records. It's searching based on the beneficiary first and last name, zip code and county, and then the date of contact. So let's just do a quick check. And it's not finding any potential duplicate records, but if there were already a record that had the same beneficiary name and date of contact, it would tell us that that's a potential duplicate record. So if you find a potential duplicate record, it doesn't prevent you from saving. So if you determine that this is actually not a duplicate, you can still go ahead and save, but it's a tool to help you quickly check if something has already been entered. So now we have some different questions about how the beneficiary tells you that they've heard about the SHIP program and how you were in contact with them. So there are a lot of different options here about how they might have heard about the SHIP program. They might have heard about it from a friend or relative, congressional office. There's so many different options here. And then the method of contact, there's a lot of different options about how to communicate with them during the counseling sessions, face-to-face, or at an event, phone call. It can be web-based since our lovely experiences 4 years ago. So I'll say it was a phone call. Now, the beneficiary age group is the start of our demographic questions. And as I mentioned, this is something that it can change. This is the main one that can change. And so that's why it's important to be periodically definitely entering new beneficiary contacts as opposed to additional sessions. So we will say that they are over 65 here. I'm going to note something quick that is a common question we get. There is an error message that pops up if you select that someone is 64 and younger, or someone is there's an error message that can happen. Let me just get to that section. Sorry. So you can only select to this question, receiving or applying for Social Security benefits, disability or Medicare disability. You can only select yes if you've said that they are under 64. There will be a thing that'll pop up when you save if you select that they are over 65. We know that there are some instances when someone can be over 65 and receiving Social Security disability. However, in this instance, if you run into that error, what you should do is you should make sure that the beneficiary age group is correct. So make sure you would keep it at 65 to 74, and then you'd say no for receiving or applying for Social Security disability. It's a limited number of instances where this can happen. So here I clicked yes, and then that popped up. So we'll put no. And the reason for that is we want to know whether the person is eligible for Medicare based on their age or based on disability status. And so the important thing is to know whether or not they're over 65, really. So we're going to highlight the fact and make sure that's correct that they are over 65 here. That's just a limited number of instances, but we have gotten that question a few times. So now we are into the SOGI, sexual orientation and gender identity questions. As Ginny and Maggie discussed, these are going to be changing. but I will enter some of these here. Say this person says they're bisexual, female, and they do not consider themselves to be transgender, or perhaps they prefer not to answer. We'll say no. So now we have questions about beneficiary race. There are these different topics here. We recognize that this doesn't encompass all the different identities that a person may have. However, that's limited because of federal data requirements. So we're not able to change the categories here, but you can select multiple categories. So let's say this person has multiple different racial identities. And then there's a question about whether English is their primary language, yes or no. This is important because there's special reports that track the number of people reached who are English is not their primary language. Then, of course, we have this question that Jenny went over, whether you or a family member ever served in the military. We'll say yes, they say yes. And the last demographic questions are the monthly income and assets, and that's defined here. And we'll say they're at or above. But yeah, that's defined on the side there. So now we have a long section, which is topics discussed. It is where you record the nature of what you discussed with the beneficiary without having to write a very long narrative. So check all the topics that apply. At least one topic is required. And again, because I am doing a MIPA contact, there are certain ones that are required. So, and again, you can look at that in the in chapter 4 of the STARS manual, but I do know that MSP application assistance and submission are contacts, so are qualifying topics. So that's what I'm going to select. Check as many as apply. Then we have information on the time spent in the contact. So you should enter your information here in minutes and hours. You can do one or both, and it will calculate it all into a total time spent in minutes. So if you say it was 1 hour, 30 minutes, it's going to calculate it into 90 minutes automatically. Pay attention to your minutes and your hours here. If you say that, for example, it was 30 hours and 1 minute, you will get a message here, I believe. Maybe it's more than that. Let's see. If you say it was 90 hours, yeah, there's a message that comes here and says, that's a lot of time. Are you sure that's correct? So just make sure that you are entering into the right section. So we could just say also 90 minutes. That would be appropriate. And then status, this has gone into in the STARS manual, but you can basically say if this is in progress or completed as a kind of tracking mechanism. So we'll say this is a completed contact. Now we come down into the special use fields. I'm not going to enter these now, but this is something that is demonstrated in the various Part D enrollment outcome videos and in the interactive online course. So this is where you would enter that data related to Part D enrollment outcomes in the first 2 fields here. Then we have the other special use fields. So these 2 fields are known as special use field 1 and 2. They were renamed because they have a very specific purpose. But then the other special use fields are kind of open fields that the either ACL or states can decide to use to track different things. So right now in chapter 4 of the STARS manual, it goes into how special use 3 is currently being used. Currently, you can enter information about MARX, marketing complaints, and Medicaid unwinding. So, for example, if you type unwinding, again, you can look into the STARS manual, chapter 4. This is a way that you can track contacts where you talked about the Medicaid unwinding. Or marketing complaints, you would type marketing. Okay. And if your state or territory has decided to use one of these other special use fields, 4 through 8, for something else, they would have a specific word that they want you to type if you're tracking like a specific topic that's not in the topics discussed. They would tell you that, and then you would track it in one of those. Then finally, we have the notes field, which is not required, but can be used to capture other details that you want to track. And then we have where you can attach files. These are primarily used for the Part D enrollment outcomes. There are specific files that are required to be attached in those cases. So again, I'd watch the videos, the interactive course, or read Chapter 7A, and that shows what to upload. And then we'll click Save. Hopefully I didn't do anything wrong. Okay, it's saving it. And yes, so we got a green message. And so this was successfully saved as a MIPA contact. Now, the last thing I'll show is how to enter that beneficiary additional session form. So the way that you do that is when you've just saved, you can click on beneficiary additional sessions. If you are just going back into a contact, like you're not entering it immediately after, this is something that happened, a while later, you can go to the tracking inbox. Under beneficiary contact, you can click and just open up that contact that we saved. And then you can click on the beneficiary additional sessions tab through there. And then you would click new. And we'll say that this was a follow-up session. We'll say that this was MIPA related, and I'll just enter some of this information here. So we do have the session location information, but you'll notice that all that demographic information is gone. So it's a much shorter form, takes a shorter amount of time to enter. And this does have to be a follow-up session. So we'll say it is a phone call. And we'll say that they called and they had a question about that submission. So they already submitted the MSP application, but they just had a question about it. So we can click more Medicaid application assistance here. That would be MIPA. And this was maybe just a 30-minute call. All right, that should save it. And then you see this is much shorter. All right, thank you. So let's, Jenny, if you want to take the screen back, then thank you. You can go back to the slides.
Okay, thank you, Sarah. And in the interest of time, I'm going to present the resources slides and then we'll open for questions. A lot of questions have been answered in the Q&A module, but we will have a few minutes left at the end for more questions. So the webinar resource for today will be there's already one in the resource library. The recording will need to be added, and then when we're ready, we can add the Q&A after we make it not have duplicate questions and answers and so on. So that'll be at a delay, but the recording will definitely be there tomorrow at the latest. If you're going into the library, after several days or even weeks, you may need to do a keyword search. So you could use STARS, for example. You could use beneficiary. It's best to use fewer words, by the way, if you're using this search in the library. However, we do have a STARS resources toolbox, and we expanded it at the end of December and in January to include subtopics. So here you see the beneficiary contact subtopic opened, and actually there's always new resources coming in for beneficiary contacts. We have a new resource I'm going to tell you about in a minute that's in there. But this is where everything is collected about beneficiary contacts, and the links go to resources in the library, but it prevents you from having to do a whole bunch of keyword searches in the library. So our new resource is our beneficiary contacts field guide. And I believe that has been put in chat, but there's a lot going on. You may not have been able to get resources out of the chat, but this is especially intended for those of you with the STARS submitter role, a team member role. The main thing you do is enter beneficiary contacts, and it answers some of your commonly asked questions. It provides simplified instructions, and it reinforces accurate data entry. We have related webinars to this topic. The demographic data collection webinar in February is archived, or the recording and the PowerPoint and everything's in our library, also in the toolbox I just showed you. Then earlier this week, we had a webinar that covered all the different changes in STARS since June 2023. And then our last webinar in our Part 1 STARS webinar series is next week, and it's about STARS outreach and education data entry. And you can register on our website. We send announcements to people who give us permission to email you once you have an account on our website. So you may have received that already. You'll get a reminder email about that event if you do get our announcements. And then we have a Part 2 series for higher user roles coming up that follows this. It's about team member forms, reports, and advanced searches. So here's a list of examples of resources you'll find when you go to the beneficiary contacts page of our STARS resources toolbox. The STARS manual, chapter 4 is a standalone chapter, or the whole manual stitched together into one file. A printable beneficiary contact form. If you're keeping paper notes while you do a session, it'll remind you of all the things you need to ask for later data entry. That infographic on beneficiary contact forms versus beneficiary additional session forms. The script for demographic data collection, now that is specific to, well, it has some preamble text about all the demographic questions, but then it has specific FAQs about military and SOGI. And then webinar recordings, the courses, for those of you doing Part D enrollment outcomes, there's a course and more. So thank you for joining us today. We have email addresses you can use to contact us. Our STARS email address, hopefully pretty easy to remember, stars@shiptacenter.org, and that's for questions about how to use STARS. And then info@shiptacenter.org is our very broad, generic inbox for lots of things. It would be a good place to email, a good address to use if you want to know about our webinars, about our library, and so on. So that's the main content we had planned for today. And I think with all of the practice you've had with Q&A, I'm not going to change the slides, but we do have 6 more minutes. And so if you've had all of your questions answered, this has been a long session. We're not going to be offended if you leave, but we're still here to answer questions for another 5 minutes. So are there questions that we should answer over the audio, Dennis?
The only other outstanding question is more of a comment. They just really suggested emphasizing the use of notes in order to, so that when people go back to the BCF, they get a sense of what the history has been. So
Yeah,
that's a comment that somebody said.
notes can be really helpful. However, the reason we didn't emphasize them is just because there's no federal national guidance on how to use them. So you may get guidance from someone in your state or your program about how to use them, and that's fine to use. We just don't have anything specific about how we want you to use them. So it's really up for however you prefer to use them and what's most helpful to you.
Where do I find the database for the BCF? That's a search question.
I think they mean the address for STARS, which is, we didn't actually include the address for STARS in this,
Oh, okay.
in this webinar. So it's, it is STARS. I better read it because I don't want to get it wrong here. stars.acl.gov. And we can put that in the QA.
Where do we find the slides for this webinar?
That was presented on a previous slide. I can go back to that. Just a second here. Well, anyone with slide control, if you could go backward,
Sure.
I have some things open that are in my way.
Has Amy placed them in the chat? Are they in the chat, the slides?
Yes, I
this-
just chatted them a couple minutes ago
Okay.
again. Thanks.
Yeah, this is how to find this webinar resource. You can also look in the beneficiary contacts toolbox for some related things. And then this is how you would do a search to find the resource.
Another question is, how do we document application submissions for CHCPE?
I am not familiar with that program. Are you, Jenny?
I wasn't either.
Nope, I'm not either. I had answered that we needed to know what the acronym was for.
Okay.
I also saw a comment in the Q&A that somebody is saying that they do not have MIPA on the additional sessions form. It is on the additional sessions form, so I don't know why that would be. Maybe the person needs to clear their cache, but if you don't have MIPA on the beneficiary additional sessions form, please do email us at stars@shiptacenter.org so that we can forward that on to the developers and see what might be going on.
And it looks like CHCPE might be
Yep.
the Connecticut Home Care Program for Elders, if that's
Yep.
if that's it.
So-
So that would be a Connecticut specific question. And I also don't know if that is Medicare related and would count as a SHIP session. So that would be Connecticut specific.
And I think the only other question is if I checked MIPA yes on a BCF, but did not ask on the BAS, do I check yes or no? That's a lingering question out here.
I would say that if you're entering a BAS about a follow-up to a session where MIPA was a MIPA qualifying session. I guess it depends on if the follow-up is MIPA related or if the initial session was very full of many topics and the follow-up was not about anything related to MIPA. If the follow-up was not related to MIPA, you would mark no. But if the follow-up was related to their MIPA issue, you would mark yes. So just think of the BAS as a new form, a new session, and illustrate what happened in that session realistically.
Yeah, think of it as a follow-up.
We are at the end for today. So thank you, everybody. Thank you for spending time with us today, and we look forward to helping you in the future. Please don't hesitate to reach out by email, and we hope to see you in other webinars in this series.